Normal heart rate. Now take a look at this healthy human heart beating at a level of 80 beats per minute. A normal heart rate is defined by 60 to 100 heartbeats per minute in resting adults. Bradycardia is, per definition, below 60, and tachycardia above 100 beats per minute. Myocardial infarction. Due to a lack of oxygen supply through a blockage in the coronary vessels, cells can be damaged or die if not treated quickly. A myocardial infarction, also known as a heart attack, is the irreversible death of heart muscle tissue. The key to recovering is receiving treatment as quickly as possible and restoring the blood flow. The heart muscle is supplied with blood from the coronary arteries that cover it. If these arteries become narrower due to a buildup of vascular deposits and are therefore unable to bring enough oxygen-rich blood to the heart muscle, this is what we call coronary artery disease, or CAD for short. As it gets worse, this can lead to chest pain, a tight feeling in the chest, or shortness of breath, particularly during physical exertion. If left untreated, this can cause a heart attack, which in turn may cause heart rhythm disorders, chronic heart failure, or sudden cardiac death. Over the years, blood vessels are exposed to harmful conditions like high blood pressure, high cholesterol, high blood sugar, and nicotine. This causes damage, especially if these conditions are combined. The result is a buildup of fatty deposits, which can cause inflammation of the blood vessel walls. Over time, the blood vessels narrow and become thicker and stiffer due to this plaque. As the blood vessels become narrower, blood circulation is impaired, and chest pain can occur. It is particularly dangerous if an unstable plaque buildup suddenly ruptures. This can occur at any time, regardless of how narrow the blood vessels have become. The injury activates the blood platelets and the body's clotting system. A blood clot then forms. At the same time, the injury can also cause the blood vessels to constrict. In extreme cases, the blood vessel can suddenly and completely close. This is what we call a heart attack. If quick treatment is not given, the sudden lack of oxygen can cause damage or death to the heart muscle tissue cells. Arteriosclerosis is a systemic disease. The buildup of plaque not only affects the coronary arteries, it can also occur in the blood vessels in the neck that lead to the brain,